Calling my girls dirty, fellas, because you probably the reason. So who's dirty? No, okay. Okay. Hi everybody and welcome back for an educational video. Normally I would have on my nurse practitioner t-shirt, but it's somewhere in that closet and I ain't got time to look for it, so I have on my RN shirt today. But anyways, welcome back to another educational video. This video is so long overdue. I was supposed to post this video like a month ago, but nonetheless we are here. So in this video I want to talk to you guys about bacterial vaginosis, BV. Because why? There's a lot of stereotypes going around about bacterial vaginosis, where when a female catches it, people think, oh, she's dirty, she's filthy. Now she should get that taken care of. So yeah, we just gonna leave it at that. She should get it taken care of. So what is BV? What is bacterial vaginosis? So bacterial vaginosis is essentially a a vaginal infection that is caused by a lack of vaginal normal flora. So as females, we have this normal flora that you guys heard of before, and it's normal bacteria that lives in our vagina that helps clean it out, cleanse it. Some women have excess discharge, that's regular fluid, that's normal for them. But essentially the bacteria is there to help keep the vagina healthy. Okay. BV was essentially called an STI, but with more research, more testing, more education, we found that BV is not only due to sexual intercourse, it's due to multiple factors. And let's get into the factors. What causes BV? 90% of the time it's going to be because of sexual intercourse. True. Now, you could also get BV through diet, high carb, high sugar, high fat diet. You could get it through medications. Some medications disrupt the normal flora down there. You can get it with douching. Like we already stated, multiple partners, one partner. What else? Soap, detergent. And sometimes it's just not even known why a patient will get BV. Okay, so there is multiple factors, and as an NP, we have to be inquisitive and nosy. Okay, so now treatment. Well, let's get into signs and symptoms first. So signs and symptoms of BV, you will have thin, watery, gray to white, milky looking discharge, but nonetheless it's thin. Usually when you get discharge that is thick, it's because you have BV with a yeast infection. So think of yeast infection, you already know it's cottage cheesy, right? So if you have that fishy smell, the itching, the burning with thick discharge, you might have BV with yeast infection. In most cases, providers will go ahead and treat you for both, even if you just don't have symptoms of a yeast infection, but some providers will go ahead and send a prescription in for BV and yeast infection. Okay, so that's signs and symptoms. Treatment is always going to be antibiotics. The only way to get rid of that bacteria is with antibiotics. Now, there is some homeopathic providers out there that might say otherwise. I have yet to meet one, but I would love to. Homeopathic remedies are out there, but in Western medicine, there's antibiotics. We give antibiotics. There's only so much your boric acid can do. Boric acid only eradicates the smell usually, but there has been some research that shows boric acid will disrupt the biofilm. And what biofilm is, it's like a substance that is excreted. I want to say it's excreted from bacteria, but it's like a wall that encases and protects the bacteria. So sometimes that's why you have patients who come back for reoccurrence, or if you are the patient, that's why sometimes you have a reoccurrence of BV after you've been treated. It's because the biofilm needs to be broken down too, but that is a whole nother video that we can get into about biofilm and how to treat that to get rid of BV, okay? But let's stay on topic. So BV treatment is going to be antibiotics, okay? Boric acid is just going to eradicate the smell. Probiotics can help with restoring the normal flora in your vagina. Okay. What else? So how we test? We test through the EMSO criteria. And basically the EMSO criteria, you have to be positive for 3 out of the 4. Which is 1 being discharge. How is the discharge? Is it thin? Is it thick? That will help us eliminate from yeast infection, from chlamydia, from gonorrhea, the discharge. Number 2, clue cells. And how we get the clue cells is we are going to swab the inside of your vagina, put it on a smear, like a little glass slide, put it under the microscope, and it's going to show clue cells that look like these. Okay, that's 2. 3, it's going to be your vaginal pH. We want your pH to be between 3.8 and 4.5. If it's greater than 4.5, then you might have BV. And last but not least, the whiff test. So the whiff test consists of basically on that smear, on that slide, we'll put potassium hydroxide, which is KOH. It's 10% KOH, which is potassium hydroxide. We put that on the smear, and the fishy smell will illuminate. Okay, so that's how we would know if it is positive whiff test. So we'll smell the fishy smell. So 3 out of those, you're positive for BV. We will treat you. How will we treat you? Like I said before, we will treat you with antibiotics, of course. So gold standard or rule of thumb, a clinician will always prescribe metronidazole, which is also safe for pregnant women. We will give 500 milligrams twice a day for 5 days. You can also do metronidazole 0.75% intravaginally with the gel, which is 5 grams, which is like the whole applicator. And then we can also treat with clindamycin. Usually clindamycin is like the last to be given as treatment. But sometimes it could be first line for some people because they know that's what works better for them. But clindamycin, you just have to be safe. You know, stay out the sun, especially no alcohol. No alcohol with metronidazole as well, but especially you want to avoid alcohol with clindamycin. You want to avoid the sun. You want to avoid tanning during the whole course and for at least 3 days after treatment with all 3. There is other intervaginal options. One is expensive, so they don't really do that one here. And then so another one will be clindamycin cream, but I've never really seen that one be prescribed. So it's always up to your provider's discretion. Anytime you have pain, like severe pain, some bleeding, discomfort, cramping, or anything down there, you want to seek medical attention because that should not be happening. A lot of these STIs can cause disruption down here, which also entails it causes inflammation. So when you have other symptoms, usually especially with reoccurrence, your provider, if you come back and say, hey, I was treated like a week ago, a month, well, not a week because it's too soon. I was treated like a month ago, but the symptoms are back. They're even stronger, blase, blase, blase. Your provider probably will order an STI and an STD panel just to rule out anything else. For me, if a patient was to come in, I will definitely order that first anyways, off bat anyways. But depending on how recent your labs were, they will order a STI, STD panel. Now, as a provider, We have to be nosy. So we have to ask questions that probably make you feel uncomfortable. We're going to ask, how many partners have you had? What else do you stick down there? What soap do you use? What is your diet like? Do you dish? Are you engaging in any other extracurricular activities that you should not be engaging in? So, you know, it's a no judge zone, and your provider should always make you feel comfortable. But being honest will help you to eliminate the use of having to keep coming back to get treated, because you don't want to take too many antibiotics, especially of the same one, because your body can come immune to it. The bacteria will look at you like, what is this? Candy? Oh, I ain't going nowhere. So be honest with your providers, okay? And that is about it. I think I covered everything for BV. Oh, this is a big one because I know I get this a lot. Can men be treated for BV? Yes. Yes, they can be treated. Some providers will allow you to give a prescription to your partner. Some won't, because they don't find it beneficial. But if you come in and your partner was there with me and he's fine with it, I'll listen to prescript, because I mean, what's better than being safe than sorry? So yeah, you just have to know, you know what I'm saying, make sure that's the partner that you got it from, you know. But all in all, when you're taking your medication, just make sure you finish that whole full course. You don't want to stop it. If you lose some pills, call your provider back, like, hey, I need 2 more pills or something, you know, they fail. And avoid alcohol and abstain from sex for at least 3 days after your course of antibiotics, okay? So after treatment, you still want to abstain for those things for at least 3 days. And that's about it. I mean, I hope I covered everything with BV. I was trying to look here at the lens, here at the screen, like, listen, I just wanted to give y'all the tea, okay? So don't be out here calling my girls dirty, fellas, because you probably the reason. So who's dirty? No, okay. Okay. So yeah, any questions or comments, leave them down below. I am here and happy to answer them for you. Bye.